My name's Roger Angrick. This is my daughter Anna and my wife Beth Angrick. Anna has a metabolic disorder called pyruvate dehydrogenase deficiency, which is a very rare chromosomal deficiency. She was diagnosed at about 1 year old, and she continues here at Woods to be on the special diet, which really only Woods could provide of all the facilities that we found.
We live in New Jersey, 2 hours north of Woods, so we started off closer to home, looked at probably every program there was in New Jersey. She didn't fit the criteria at any of them. We said, well, what else is there that maybe isn't in New Jersey? And that's how we found Woods.
Today we see a very medical compromised population that have significant behavioral issues, complex medical needs, genetic disorders that need a very different level of care that they needed when Molly started Woods over 100 years ago. And because of that, without a healthcare component, you're not going to be able to position well in the future to take care of these very vulnerable populations. And that's what we're doing now. We're saying, let's take this health center to the next level. Let's increase the staff there, and let's over time also make ourselves available to the outside community that have kids and adults with the same special needs that people that live here have. And that begins to open up Woods to the community in a very different way. So we're really positioning Woods to continue to be the leader in the industry, integrating primary care, complex medical care, also with behavioral health services. And if we look at where the trend is, Congress, states are going, it's all about how do you manage a population, how to do managed care services, and that's what we're doing. And the health center, with all those services we're going to provide, is the anchor to make that happen.
What we want to do here is create an integrated network that is specialized in treating developmentally challenged people and our employees in a single coordinated network with an electronic medical record that will pull the pieces together and ultimately give us the best health care that we can give to everyone who's on this campus.
And we are going to be able to have more care delivered right here in a familiar setting with familiar people that our population knows and trusts and can feel more comfortable with than they would experience if they were constantly being sent out to other practices, other clinics, other centers.
I think because of the medical staff, the nurses, the doctors, he has a really good life, considering all of the limitations that he has. They work with him to make him feel that he is not just a number, he is a real person.
Our nurses, have the experience and the skill and the love and the dedication to provide all of these special services every day to this population. And I don't think that I can adequately express my profound admiration for the work that they've done in taking care of all these individuals.
Tom was home for Christmas and he choked on a marshmallow. And Stephen gave him, his brother, gave him, the Heimlich maneuver and so forth. I called for 911. Now, the reason I mention this is Dr. Leonard Graziani was such a source of comfort. Constant communication between all of the doctors for 3 months and Dr. Graziani. That is Dr. Graziani dedication, but it's also Woods dedication. I can't say enough.
Anna's still learning, she's still growing. She needs that kind of a behavioral type of program so that she can continue to learn, but she needs her medical needs met at the same time, and they need to be intertwined, and not many places can do that. And Woods does that seamlessly.